I want you to imagine for a moment that you are sitting across from a financial advisor, and they tell you this. There is a deadline coming up in your life. If you miss it, not by years, not by decades, but potentially by just a few months, you will pay a financial penalty every single month for the rest of your life. Not a one-time fee, not something that goes away after a few years. Every single month for as long as you live, a surcharge will be added to your bill. And here is the part that makes it even harder to hear. Most of the people who pay this penalty had absolutely no idea the deadline existed until it was already too late. I am talking about the Medicare late enrollment penalty, and in 2026, it is quietly hitting more retirees than most people realize. My name is Finn, and this is Finn Retires, the channel built to make sure you know the rules before the rules cost you money. If you are new here, hit that subscribe button right now before we go any further. Every week on this channel, we cover the financial decisions that matter most for retirees, and today's video is one that is directly relevant to anyone who is approaching 65, anyone who recently retired, or anyone who has a parent or spouse in that window right now. This is not a topic you can revisit later without potentially paying for the delay. So subscribe, stay with me, and let us make sure this penalty never lands on your bill. Let us start with the foundation, what this penalty actually is and why it exists. When Congress created Medicare, they built it around a basic principle. The program works best when healthy people enroll and contribute alongside those who need care. To encourage timely enrollment, they created financial penalties for people who delay signing up without a qualifying reason. These penalties are not designed to punish intentional wrongdoing. They are structural incentives built directly into the premium calculation. And once they are applied to your account, they follow you permanently, appearing on your monthly bill month after month, year after year, for as long as you remain enrolled in Medicare. For most Americans, that means for the rest of their lives. There are two separate penalty systems you need to understand. One for Medicare Part B, which covers doctor visits and outpatient services, and one for Medicare Part D, which covers prescription drugs. They operate differently, they are calculated differently, and both are entirely avoidable with the right timing and information. Let us start with Part B, because it is the one that catches the most retirees off guard and carries the most significant financial consequences. The Medicare Part B late enrollment penalty is calculated as 10% of the standard monthly premium for each full 12-month period that you were eligible for Part B but did not enroll. In 2026, the standard Part B premium is $202.90 per month. That is your baseline. If you were eligible for Part B and missed your enrollment window by one full year, meaning 12 consecutive months passed without coverage, your monthly premium goes up by 10% of $202.90, which is approximately $20.29 per month, added permanently to your bill. If you missed it by 2 years, that becomes 20%, roughly $40.58 added permanently. 3 years, 30%. 5 years, 50%. 7 years, 70%. And these are not hypothetical numbers. According to Medicare Interactive, if you delayed enrollment in Part B for 7 years and did not have qualifying employer coverage during that time, your monthly premium would be approximately $344.93 per month instead of the standard $202.90. That difference, $142 every single month, never disappears. It stays on your account for as long as you are enrolled in Part B. Over a 20-year retirement, even a 2-year delay that adds $40 per month to your bill accumulates to approximately $9,600 in extra premiums paid, money that comes directly out of retirement savings for something that was entirely preventable. And here is the part that compounds the damage over time. The penalty percentage is fixed, but the dollar amount is not. The penalty is recalculated every year based on whatever the new standard premium is. So if Medicare raises the standard Part B premium next year, which it has done most years throughout Medicare's history, the dollar amount of your penalty goes up too, even though the percentage you are being penalized has not changed. A retiree paying a 10% penalty today will pay a larger dollar amount next year, simply because the underlying premium increased. The penalty grows with Medicare inflation for the rest of your life. Now let me talk about the enrollment windows, because understanding exactly when you are required to enroll is the most critical piece of information in this entire video. Every person who is approaching age 65 has what Medicare calls an initial enrollment period, a 7-month window to sign up for Medicare Parts A and B. This window begins 3 months before the month you turn 65. It includes your birth month, and it ends 3 months after your birth month. 7 months total. If your 65th birthday is in July, for example, your initial enrollment period runs from April through October. If you enroll during the 3 months before your birth month, your coverage begins on the first day of your birth month. If you enroll during your birth month, coverage begins the following month. And if you enroll in any of the 3 months after your birth month, coverage is delayed further, starting 1 to 3 months after you actually sign up. Most people are best served by enrolling in the 3 months before their 65th birthday to get the earliest possible coverage start date without any gap. What happens if you miss this 7-month window? The next opportunity to enroll is the general enrollment period, which runs only from January 1st through March 31st each year. If you miss your initial enrollment period in, say, October, and you realize your mistake in November, you cannot enroll immediately. You have to wait until January at the earliest. And even then, after you enroll during the general enrollment period, your coverage does not begin until July 1st of that same year. That is a potential gap of coverage that can last anywhere from several months to over a year. During that gap, any medical expenses you incur are entirely your own responsibility. And when coverage finally does begin, the late enrollment penalty has already been applied. Now here is where I need to spend extra time, because there is a specific misunderstanding that catches more retirees than any other, and it involves COBRA coverage. Many people who leave an employer at or near age 65 choose to continue their employer-sponsored health insurance through COBRA while they figure out their next steps. This is completely understandable. COBRA coverage is familiar. It covers the same network of doctors, and it feels safer than navigating an unfamiliar new system like Medicare. But here is the critical fact that no one explains clearly enough. COBRA coverage does not count as active employer-sponsored insurance for Medicare's purposes. It is not the same thing. And this distinction is the source of one of the most expensive and most common Medicare enrollment mistakes in the country. The reason this matters involves a provision called the Special Enrollment Period. If you are still covered by active employer-sponsored insurance, meaning you or your spouse is currently employed and the coverage comes through that active employment, you do not have to enroll in Medicare during your initial enrollment period. You have a special enrollment period that gives you 8 months from the date that active employer coverage ends to enroll in Medicare Part B without any penalty. This is specifically for people who are working past 65 and have genuine employer coverage tied to active employment. The key word is active. Active employment, active coverage. The moment that active employment ends and you shift onto COBRA, even if it feels like the same insurance and even if it covers the same doctors, your 8-month special enrollment period has already started. COBRA is not a pause button. The clock is running from the day your active coverage ended, regardless of whether you are still paying COBRA premiums. If you wait until your COBRA coverage actually expires before enrolling in Medicare, and that expiration comes more than 8 months after your active employment ended, you have missed your special enrollment period entirely, and you will face the permanent late enrollment penalty. Let me put a specific person in this situation so the reality is completely clear. Think about a retired engineer named Dennis. Dennis turned 65 in March and left his job the same month. He chose to continue his insurance through COBRA for 18 months rather than dealing with Medicare immediately. He felt covered, his doctors were in-network, and he figured he would sort out Medicare when his COBRA ran out. His COBRA expired in September of the following year, 18 months after he retired. Dennis then went to sign up for Medicare Part B, assuming his recent COBRA coverage qualified him for the special enrollment period. He was wrong. His 8-month special enrollment period had started in March of the prior year, the moment his active employment ended, and it had expired in November of that same year. Dennis enrolled in Medicare 17 months after his initial enrollment period ended. The penalty calculation counted one full 12-month period of delay, adding 10% permanently to his monthly Part B premium. For the rest of his life, Dennis will pay more for Medicare Part B than he would have if someone had explained the COBRA rule to him before he made his decision. Dennis's story is not rare. It happens every single year to thousands of retirees who made a completely reasonable-sounding decision without knowing the rule that made it expensive. Now let us talk about Medicare Part D, which is the prescription drug coverage component, because it carries its own separate late enrollment penalty that operates on a completely different calculation. If you go 63 consecutive days or more without Medicare Part D coverage or other creditable drug coverage after your initial enrollment period ends, you will begin accumulating a Part D late enrollment penalty. The penalty is 1% of the national base beneficiary premium for each month you went without creditable coverage. In 2026, the national base beneficiary premium for Part D is $38.99. So if you went without creditable drug coverage for 12 months, your penalty is 12% of $38.99, approximately $4.68, added to your monthly Part D premium. That may sound small, but it accumulates over time, and it is recalculated every single year based on whatever the new national base premium is, meaning the dollar amount of your Part D penalty can increase every year, even if the percentage stays the same. For retirees who went several years without Part D or creditable drug coverage, the penalty can become meaningful, and like Part B, it lasts for as long as you have Part D coverage. The term creditable coverage is important here and deserves a clear explanation. Creditable drug coverage means coverage that is expected to pay, on average, at least as much as the standard Medicare Part D plan. Many employer-sponsored drug plans are considered creditable, meaning if you had active employer coverage with drug benefits that qualified as creditable, that time does not count against you for the Part D penalty calculation. Your plan is required by law to notify you each year whether your drug coverage is creditable. If you receive that notice and it says your coverage is creditable, keep it. That document is your proof of continuous creditable coverage and can be essential if a Part D penalty is ever questioned or disputed. If you are on an employer plan and approaching retirement, ask your benefits administrator specifically whether your drug coverage is classified as creditable for Medicare purposes before you make any enrollment decisions. I also want to address one more important element that surprises retirees, and it involves marketplace or individual health insurance plans purchased through the Affordable Care Act exchanges. If you are enrolled in a marketplace plan and you turn 65, that marketplace plan does not count as qualifying coverage that protects you from the Medicare late enrollment penalty. Medicare is considered your primary coverage at 65, and the expectation is that you will transition from your marketplace plan to Medicare. If you choose to stay on your marketplace plan past 65 and skip Medicare enrollment, you are accumulating late enrollment penalties the entire time. The marketplace plan may feel like it is covering you, and it will provide coverage in terms of medical care, but it does not satisfy Medicare's enrollment requirement. When you eventually transition to Medicare, the penalty will apply based on how long you delayed, regardless of the fact that you had marketplace coverage during that time. So what should every retiree do to make sure they navigate this correctly? The answer starts with knowing your dates. Mark your 65th birthday on a calendar and count back 3 months. That is when your initial enrollment period begins. If you plan to continue working past 65 under active employer coverage, confirm with your benefits administrator whether your coverage qualifies as active employer-sponsored insurance for Medicare purposes, and track exactly when that coverage will end, because your 8-month special enrollment period clock starts on that date, not when your COBRA expires. If you are not certain whether your drug coverage qualifies as creditable, ask your plan in writing and keep the response. And if you are already past 65 and you have not enrolled in Medicare, do not wait another month. Contact Medicare directly at 1-800-MEDICARE or visit medicare.gov to understand where you stand and what your options are. There is also a lesser-known resource worth mentioning here. Every state in the United States has a program called SHIP, the State Health Insurance Assistance Program, which provides free, unbiased counseling to Medicare beneficiaries and people approaching Medicare eligibility. SHIP counselors are specifically trained to help retirees understand enrollment windows, evaluate their penalty situation, and identify their options. They do not sell insurance products, they have no financial interest in the advice they give, and their service is completely free. If you have any uncertainty about your Medicare enrollment situation, a SHIP counselor is one of the best first calls you can make. You can find your state's SHIP program by visiting shiptaycenter.org. One final thing I want to address before we wrap up, and it is something I am asked about regularly. Is there any way to get the late enrollment penalty waived after the fact? The honest answer is that it is extremely rare, but not technically impossible. If you received incorrect official information from the Social Security Administration or from Medicare itself that caused you to miss your enrollment window, you can apply for something called equitable relief. The process requires documentation, the burden of proof is entirely on you, and approvals are uncommon. It is a path that exists, but it should be treated as a last resort, not a safety net. Prevention is infinitely more effective, more certain, and less stressful than appeal. Here is what I want you to do right now before you close this video. If you are within 3 years of turning 65, in either direction, sit down today and map out your Medicare enrollment dates. If you are already past 65 and have not enrolled in Part B or Part D, call Medicare at 1-800-MEDICARE and find out where you stand. And if you have a parent, a sibling, or a friend who is approaching retirement and has not thought about this yet, please share this video with them today. The Medicare late enrollment penalty is one of the most preventable financial losses in retirement, and the only thing standing between a retiree and this penalty is information they received at the right time. Your share today could save someone in your life thousands of dollars. Drop a comment below and tell me, did you know about the COBRA trap before watching this video? Were you aware that COBRA does not restart your special enrollment period? I genuinely want to know because the answer tells me how well this information is getting out to the people who need it. Share your experience below, and if you have already navigated Medicare enrollment, tell me what surprised you most about the process. I read every comment on this channel, and your story might be the most useful thing someone else sees today. The next video on this channel is going deeper into Medicare, specifically the difference between original Medicare and Medicare Advantage, and the things insurance companies do not volunteer to tell you before you choose. If you are not yet subscribed, hit that button now. You do not want to make this particular decision without the full picture. Take care of yourself, protect your retirement income, and I will see you in the next one.